We're here now with Neil Dunlap, who is a professor of radiation and oncology at the University of Louisville. I assume that's in the School of Medicine, right, Neil?
Yeah, yep.
Okay.
Got that right.
All right, you're going to talk about a new process for imaging lungs, and especially the lungs of folks who have cancer, lung cancer, correct? So
Right.
Tell us what you're working on.
So, unfortunately, the state of Kentucky kind of sits at the top of some of the negative categories in terms of healthcare, and one of those is the number of people getting lung cancer and also the death rate of lung cancer. So there's a lot of people that go through this.
Isn't Kentucky number one in lung cancer deaths?
We lead the nation. We like leading the nation in basketball, but also in lung cancer too, unfortunately. So there's a lot of room for improvement in how we take care of these people. And as a radiation oncologist, really my job is to deliver radiation treatment to try and cure these people. The problem is that we injure people's lungs quite frequently, and we don't really understand how that injury process works. And so in conjunction with the Speed School, we've developed some imaging software that just got a patent on to look at how we can better determine how the lung is damaged from radiation treatments for people going through lung cancer.
And so how's it work? Is it just like an X-ray machine, or what does it do?
We use a CAT scan machine that's really already in place in our department, and it's an imaging processing software that looks at how the lung moves. So you can imagine a rubber band. That's what our lung is like. It has elasticity to it. So it stretches and contracts, and that changes over time when you damage the lung. And so some of that is really hard to pick up on a scan, but we've developed a new type of software that actually can look at the stretching of a lung and determine how that changes over time. And so we may be able to pick up some of these changes early to intervene to prevent people from having permanent damage when they're going through these treatments.
So the radiation treatment is actually doing damage to the lungs.
Right.
So you're trying to figure out exactly how much damage and whether you should stop the radiation treatments or limit them. Is that the idea?
Right, and adapt them. So really, we used to think it's a one-size-fits-all for everybody, but now we enter this era of what's called personalized medicine, where we want to adapt what we're doing in terms of treatment to an individual. And so if we can learn how a person's lungs are changing during treatment, we can modify things to protect them and prevent long-term complications. I mean, most of these people have underlying emphysema and problems breathing as it is, and we don't want to make that worse. I always tell my patients, look, our goal is to cure your cancer and get you back to living a normal life. And if we're causing all kinds of injury where they can't even just walk down the street to go to the grocery store or get their mail, that's a problem, and we want to try and prevent that from happening.
We're talking with Neil Dunlap, who's a radiation and oncology professor at the University of Louisville, about a new way of imaging the lungs of folks who have lung cancer. Could this be used for other things? You mentioned emphysema. So if in the future, might this be used for something else?
Yeah, so right now there's not a great way to determine how people's lungs are changing over a period of time. And so when you are a smoker, you have chronic asthma, it can really affect how your lung function's working. And right now we do a lot of breathing tests, but it doesn't actually take good pictures of the lung to determine individual areas that may be good or bad. And so this would allow us to detect those changes in a more subtle fashion without things like biopsies or other invasive procedures.
And you have a patent. So what's that mean?
So basically, the federal government recognizes that this is a unique technology and that our method is basically protected so that other people don't copy what we're doing.
And is this being used widespread now, or is this just at University of Louisville?
Right. So there are other institutions around the country that have adapted similar methods to analyzing this, but ours is a unique software package. And so right now it's in a clinical trial that we have open at the Brown Cancer Center looking at how we analyze these lung cancer patients. And so our goal is to enroll 100 patients on this study, and we are about halfway through the trial. And then hopefully we'll have more broad spread application of this technology.
And how many patients are in that clinical trial?
So that right now we've got about 40 people on it, and our goal is to get 100. So we've been working hard.
Well, you can make the pitch right here.
There you go.
So if there's some folks out there listening and they have developed some lung cancer, should they contact you if they're interested in going through this process?
Yeah, I mean, that's the unique thing about University of Louisville is that we really have this kind of multifaceted approach to lung cancer treatment where we integrate specialists that treat only these types of cancers, but also we can put people on clinical trials and introduce new technologies that other healthcare systems in the area don't really have available to them. So it really provides a unique opportunity for people to get quality care and be part of a process that may not only help them, but help other people in the future.
If you've got 40 folks involved in this clinical trial right now, you're hoping to get 100, and then down the road, I guess mass market, for
Yeah.
lack of a better term,
Right.
this technology and this
Yeah.
software. How long might it take between the time you get these 100 patients that you're hoping to test this on
Mhm.
and it actually hits the market and it might be used widespread across the United States?
So hopefully within the next 5 years or so. So what our goals would be is to partner with a larger corporation that has other imaging software that they could build it into their system to mass market this. So we're kind of small potatoes right now, but you really want to partner with larger companies that can market the software.
Let's broaden this a little bit. You're a radiation oncologist dealing with these cancer patients. How important is it for someone, especially in Kentucky, where you've got a lot of lung cancer, a lot of smokers,
Right.
to come forward early, and get the, I guess a chest X-ray or whatever it takes
Right.
to detect lung cancer quickly?
So it's extremely important. There's actually a lot of evidence out now that what's called low-dose screening CT scans make a huge difference in survival for these patients. So if you're a person between the ages of 50 and 74 and you've been smoking for a number of years, the new national guidelines are that you should have a yearly screening CT scan, which is a low-dose CT scan that's offered at pretty much every hospital here in the city. It's a very easy test to do, and it can really change your life. If we detect these cancers early, they're curable. Late-stage lung cancer is not curable. And so really, if we can catch people early, we can make a huge impact on the health care in this state, especially. This is a public health crisis right now in the state of Kentucky, and we really need to do our best to try and head it off at the pass before it gets worse.
Well, let me back you up. You said that CT scans should be done every year if you smoked for how many years?
So really, what the guidelines say is 20 pack years, which means a pack a day for 20 years. So if that's what you've been smoking and you're between the ages of 50 and 74, the recommendations are for a yearly CT scan. Your primary care physician can order those, or you can just show up at the hospital and request one too.
And how many people, what percentage of lung cancer or potential folks that have been smokers are actually doing these? It can't be that.
Very few.
Yeah.
It just really is now reaching the guidelines. And the problem is a lot of insurance companies haven't covered this, but now Medicare covers it, and we're starting to see private insurance companies pick up the tab for this. Most hospitals will do a reduced rate, and you can pay, it's usually $89 to $100 for one of these scans. So it's not super expensive, but it can save your life.
All right, we're talking with Neil Dunlap from the University of Louisville. He's talking about radiation and oncology. He's a professor at UofL. A couple more questions before we wrap this up. Do you think that we will ever see a point in the state of Kentucky where smoking will be taken as seriously as you call it a health hazard, a health crisis, as we should?
Well, the state has a new initiative called the 2020 initiative, where we're really trying to intervene and reduce smoking related illnesses in this state. And so I think we're starting to see headway in this, where the number of new smokers is decreasing. So we've really just got to get the message out there that smoking is terrible for you, and it's a hard habit to quit, but we've really got to get the message out there.
I remember, and this was years and years ago because I'm old. But when I was a kid, they had you take in the smoke, or they had someone take in the smoke, and then they blew it through a handkerchief, and they showed all the stuff that was nasty on the handkerchief to show you what's going in your lungs. Are there any programs like that to scare the bejesus out of kids these days and say, look, if you start smoking, here's the stuff that's going in your lungs, and here's what's going to happen to you?
Right. We definitely have those initiatives set up, and so there's a lot of education, especially in schools now. When I was in medical school, I used to go around to elementary schools and bring in models of what someone's lung looks like. I mean, it looks like a dirty old rag. It's terrible, and I think people they have a hard time looking at something like that and saying, this could be me. And most of us, especially when you're young, you feel invincible, like nothing's ever going to happen to you, and it's not a big deal. But the problem is it is a big deal. And not only does smoking increase your risk of lung cancer, but heart attacks as well. And so we really need to curb this issue now.
Our last thing, if people want to get a hold of you to talk about lung disease or radiation oncology, or this new method to get in your clinical trial for the software, how do they do that? How do they get a hold of you?
So you can call the James Garden Brown Cancer Center, the Hope Line, or you can call our radiation oncology department directly. So it's real important, and we make our best effort to treat you just like you're one of the family and take as good care of you as you can.
All right, Neil Dunlap, thanks for being with us. Appreciate it.